Today is National Wear Red Day to raise awareness that cardiovascular disease is the #1 killer of women.
And here at WKOW, we are proud to support the effort. Joining us today is a survivor, Anne-May Minichiello. Thank you so much for being here.
Thank you so much for inviting me.
Yes.
Thank you, I really appreciate it.
I've known you for years. You have quite a story to share. Always a joy having you.
Thank you.
You'll be the featured heart hero at the Go Red for Women luncheon on February 23rd. You'll be able to share your story there. So you had something terrifying happen to you after pregnancy.
Yes, after Skylar was born, that was my first daughter, I experienced postpartum cardiomyopathy, is when your heart suddenly goes into failure shortly after you give birth.
Which is terrifying.
Yes.
And you had no previous health condition, correct?
No cardiovascular risk. My parents didn't have any issues or anything, so this was really shocking to us when it happened.
Yeah, and you were a triathlete, weren't you?
I was a
So very
triathlete,
healthy.
yes,
Yeah.
very healthy, doing all the right things, eating well, exercising well, all that, but this just suddenly shocked our world when this happened.
Yeah. Ever since then, you've been a really strong advocate for heart health through the American Heart Association. Why is that so important to you?
It's really important to raise awareness about cardiovascular health, particularly for women. A lot of people don't really know the statistics and the inequities that women face, especially people of color. So women and even people of color are more or less likely to be given CPR as a bystander. Maternal health in terms of the United States has the #1 maternal death risk from cardiovascular health too. So that's really important to me to advocate and raise awareness to show that these issues are so important.
And you talked about some of those numbers, but they really are startling. Nearly 45% of women over the age of 20 are living with some form of cardiovascular disease. Many of us don't even know. How can we collectively change those statistics?
Yeah, so it's really important. American Heart Association is leading a team of Nation of Lifesavers, and what that means is that anyone can empower themselves to save a life by learning hands-only CPR, calling 911, and pushing hard and fast to the beat of 100 to 120 beats per minute, as well as using your voice to go advocate for research for RED.
Yeah, always incredibly important. And so you have 2 children now.
I do,
And
yes.
how are you doing? How are you feeling?
Yeah, I'm doing excellent. So my heart is back to health. My girls are wonderful and beautiful and healthy. I know that they're wearing red today. But I also want to just emphasize the importance that even though my heart story, my battle against heart disease may be over, there are so many others that aren't. So my sister Christine, who has experienced 3 open heart surgeries, and she'll probably have more. And then I also lost my friend Allison with a heart failure too after she gave birth to her daughter Ada. So she leaves home her daughter Ada and my friend Elliot. So that's why this issue is just so important to me.
Yeah, and you really don't hear about that enough, I think, of the dangers post-pregnancy, postpartum. So many things to talk about, and I wish we had more time with you, but thank you so much for being here and sharing your story.
Of course, thank you so much.
Yeah, looking forward to it at Go Red for Women. Tickets are still available for the Go Red for Women luncheon. We are proud sponsors of the event. I'll be emceeing once again this year, and we'll post a link to more information on our website, WKOW.com. Anne-May, thank you so much.
Yeah, thank you so much, Amber. Thanks, Caroline.
Thank you.